Hi guys, it's me, Professor D, and welcome back to my channel. On this video, we're going to be covering health and wellness. If you haven't done so already, guys, please don't forget to like and subscribe below. Also, I'm now on TikTok, so you can follow me on TikTok. My handle is still the same, Nexus Nursing. You can also find me on Instagram, Nexus Nursing as well. All right, guys, so let's start with the first question. To increase quality and years of healthy life, Healthy People 2020 focuses on 4 areas. One of those areas is A, allowing people to continue current behaviors to reduce the stress of change. B, focusing only on individual health changes that will lead to better communities. C, creating social and physical environments that promote good health. Or 4, focusing on illness treatment to provide fast recuperation. And the correct answer, guys, is 3, creating social and physical environments that promote good health. Why? Promoting good health is a form of what? Primary prevention. Remember, you have primary, secondary, and you have tertiary. Primary prevention is education. You want to teach and educate the patients so they don't get sick. So primary form of prevention is education and what? Immunizations. Then you have secondary prevention. Secondary prevention is when you're actually screening for a disease process or you want to see how bad it is. So a form of secondary prevention would be something like mammography or colonoscopy. And then you have tertiary prevention. Tertiary prevention is when the patient already has the disease or disorder, but you want to prevent it from getting worse. So a form of tertiary prevention would be something like rehab, physical therapy, occupational therapy. Okay, so 3 is the correct answer for that question. Moving on. According to the World Health Organization, what is the best definition of health? A, simply the absence of disease. B, involving the total person and environment. C, strictly personal in nature. Or D, status of pathological state. And guys, the correct answer is B, involving the total person and the environment. Guys, this includes the physical, mental, and social well-being of the person. Now, I want us to look at the wrong answer choices. We have A, simply the absence of disease. Absolutely not. It's way more than that, as evidenced by our correct answer, which is B. Choice C says strictly personal in nature. Remember what I taught you about test questions, guys. Stay away from absolutes. When it says strictly, that means it's severely limiting to something. We stay away from absolutes such as this. Wrong. And then we have choice D, status of pathological state. That's actually the opposite of health. So the correct answer is B, involving the total person and the environment. The healthcare model that utilizes Maslow's hierarchy of needs as its base is the blank model. A, health belief. B, health promotion. C, basic human needs. Or D, holistic health. By the way, guys, if you're new to my channel, just go ahead, press the pause button if you need a little bit more time to think about your answer. Whenever you're ready, press play and we will resume. So guys, the correct answer is C, human basic needs. And if you've been following my videos for any amount of time, I always tell you this, guys, 90% of your test questions are based on either ADPI, ABCs, or Maslow's hierarchy of needs. Your basic needs and the foundation, right? The very bottom, the foundation, what everything is built on. The foundation of Maslow's hierarchy of needs is physiological integrity, what physically keeps that patient alive. So that's always going to be our priority, guys. The patient's blood pressure, pulse, respiration, glucose, fluid electrolytes, nutrition, anything that is physically keeping that patient alive, that's going to be our priority on Maslow's hierarchy of needs. Next question. Many variables influence a patient's health beliefs and practices. Internal and external variables influence how a person thinks and acts. An example of an internal variable would be A, perception of functioning, B, family practice, C, socioeconomic factors, or D, cultural background? All right, guys, and the correct answer is A, perception of functioning. And by the way, guys, it doesn't only include your perception of functioning, also includes your developmental stage, your intellectual background, and emotional factors as well. You see choices B, C, and D, all of those are external variables, not internal, okay? So the correct answer for this question is A. The nurses working in a clinic that, I cannot speak this morning. The nurses working in a clinic that is designed to provide health education and immunizations. As such, the clinic is designed to provide A, primary prevention, 2, secondary prevention, 3, tertiary prevention, or 4, diagnosis and prompt intervention. Don't play with me because I just told you guys like 2 minutes ago what the answer was. When it comes to education and immunization, that's what? Primary prevention. And guys, you have to know this because if you're taking fundamentals of nursing, yes, you're going to see this on your exam, but you're going to see this again down the road when you're taking NCLEX. You may possibly see this concept because NCLEX is very, very, very big on primary preventative measures. NCLEX is very big on educations and vaccinations because it's easier and better, more cost effective, and it's health-wise more effective to actually prevent disease than to treat it, okay? So don't forget, education, immunization, that's primary prevention. Screening, such as diagnostic tests, that is secondary prevention. Trying to keep a disease or disorder that the patient already has, but trying to keep it from getting worse, such as rehab, that is tertiary prevention, okay? All right. Let's see if I drilled this into your head. A patient admitted to the ER of the local hospital from home and reports chest discomfort and shortness of breath. She's placed on oxygen, her labs and blood gases are drawn, and she's given an electrocardiogram and breathing treatments. What level of preventative care is the patient receiving? A, primary prevention, B, secondary prevention, C, tertiary prevention, or D, health promotion? Okay, guys, if you chose B, you got it correct, because if you go back to the question, you see that they're doing tests to figure out what's wrong with this patient. They're drawing labs. They're doing the EKG. They want to figure out what's wrong and figure out the extent of the disease process, right? So that is secondary prevention measures. We want to prevent complication. We want to find out how bad it is. We want to know what's going on with the patient, and we want to find out how bad it is. All right, let's try this again. A patient's admitted to the rehab facility following a stroke. The patient has right-sided paralysis and is unable to speak. The patient will be receiving physical therapy and speech therapy. What are these examples of? A, primary prevention, B, secondary prevention, C, tertiary prevention, or D, health promotion? All right, I know you all chose C, tertiary prevention. Very, very good. Why? Because this patient is at a rehab. And remember, tertiary prevention is where we're trying to limit the extent of the complication of the disease process or the disorder. Risk factors can be placed in the following interrelated categories: genetic and physiological factors, age, physical environment, and lifestyle. The presence of any of these risk factors means that A, the person with the risk factor will get the disease. B, the chances of getting the disease are increased. C, the disease is guaranteed not to develop if the risk factor is controlled. Or D, risk modification will have no effect on disease prevention. And the correct answer is B. The chances of getting the disease are increased. So for example, if you're a Black male, you have a higher risk of getting colon cancer. For example, if you are an Asian woman of short stature, you're at risk for developing osteoporosis. Okay, so that's what it means. The chances of getting the disease are increased. The nurse is caring for a patient who's been trying to quit smoking. She has been smoke-free for 2 weeks, but had 2 cigarettes last night and at least 2 this morning. What should the nurse anticipate? A, the patient does not want to and will never quit smoking. B, the patient will return to the contemplation or pre-contemplation phase. C, the patient will need to adopt a new lifestyle for change to be effective. Or D, the patient must pick up her attempt right where she left off. And the correct answer is B, the patient will return to the contemplation or pre-contemplation phase. So when relapse occur, they're going to go through this stage before trying again. Okay? Before they try again, they're going to go through either the contemplation or the pre-contemplation phase. Now, let's look at our wrong answer choices. We have A, the patient does not want to and will never quit smoking. Excuse me, what did I tell you about absolutes? Always, never, only. I told you to stay away from them, okay? So don't say the patient will never quit smoking. How do we know that? So that's false. Throw it out. Choice C, the patient will need to adopt a new lifestyle for change to be effective. This patient's trying. And so we can't wait until that patient develops a whole new lifestyle to try, because guess what? It's never going to happen. So that's absolutely false. We're going to throw that out. Now we have choice D, the patient must pick up her attempt right where she left off. No. This patient has to go through several stages before change can occur. So the correct answer, guys, is B. Okay, the nurse is working in a drug rehab clinic and is in the process of admitting a patient who says that she wants to be detoxified. It is important for the nurse to A, identify the patient's stage of change, B, realize that the patient is ready for change, C, instruct the patient that she will have to change her lifestyle, or D, instruct the patient that relapses are not tolerated. And the correct answer, guys, is A, identify the patient's stage of change. We have to know where that patient is. Are they in the pre-contemplation, preparation, action stage? Where is that patient? We have to find that out first before we know how receptive that patient's going to be to the teaching, before we know how willing that patient is going to be to change, right? So the very first thing we have to do is find out that baseline. Where are they in that stage of change? The patient has been overweight for most of her life. She has tried dieting in the past and has lost weight only to regain it when she stopped dieting. She's visiting the weight loss clinic health club because she has decided to do it. She states that she will join right after the holidays in 3 months. The nurse recognizes that the patient is in which stage of the change process? A, the pre-contemplation stage, B, contemplation stage, C, preparation stage, or D, action stage. And the correct answer, guys, is B, contemplation. This is when they consider changing within the next 6 months. Okay, let's look at our wrong answer choices. A, pre-contemplation stage. This is where they have no intention of changing. Okay, they're not there yet. Then we have the contemplation, which is the right answer. They're considering changing within the next 6 months. Then you have the preparation stage where they're willing to make small changes. And then you have the action stage where they want to actively do things to change. Okay. But for this question, because the patient says after the holidays in 3 months, so they're willing to change, but they're willing to do it not now, within the next 6 months. That's why the correct answer is B, the contemplation stage. A patient has quit smoking and has been smoke-free for the past 2 years. Of the following stages, which best fits her current stage of change? A, contemplation. B, preparation. C, action. Or D, maintenance. And I know you all chose maintenance because I just told you what all the other stages meant, right? Well, maintenance, this is when the patient's maintaining that changed behavior. They don't want to revert back to that old behavior. They're maintaining that changed behavior. So the correct answer, guys, is D, maintenance. All right, guys, we are on our last question. The patient had a colonoscopy a week ago. When approached by the nurse, the patient and his wife refused to talk about it and refused to be taught about how to care for it. The nurse realizes that the patient and his wife are in which stage of adjustment? A, shock. B, withdrawal. C, acceptance. Or D, rehabilitation. Okay, guys, and the correct answer is withdrawal. They are completely withdrawn from the situation. They're refusing to even acknowledge that there has been a change. Okay, so this is the correct answer. A, shock. Shock happens when whatever that situation is initially happens. The patient goes into shock. They go into denial. I can't believe that this is happening, right? That's the shock phase. Acceptance, that's when they're actually acknowledging this change that has happened, okay? And they accept it, all right? And then rehabilitation phase is this phase where they're actually willing to learn. Not only have they accepted this change, but they are willing to learn how to work with this change and find out what they have to do to prevent complications down the road. But for this situation, the couple has gone through the withdrawal phase where they're not even acknowledging what is wrong. They don't want to deal with it. They don't want to learn, nothing. They're going through the withdrawal stage. Guys, I hope that you guys found this video to be helpful. As always, please leave me a comment if there's a video that you'd like me to cover that I haven't done so already. Please don't forget to like and subscribe below. And also, guys, please join me on TikTok. The 1-minute videos that I do on TikTok, they are different than the videos I do here at YouTube. So, you know, if you're at the gym or you're on the go and you just want to get some quick study time, you can go ahead and listen to my TikToks. I have plenty of material on there for you. Thank you for joining me, and I'll see you on the next video.